Thank you. Good afternoon. Thank you so much for this committee's work. Tremendous presentations today. My name is Krish Gundu. I'm the co-founder and executive director of Texas Jail Project. We're a small statewide nonprofit working on county jail conditions. We help families navigate the intersection of the public mental health system and the pretrial detention system. I'm also a voting member of the Administrative and Rules Advisory Committee of the Texas Commission on Jail Standards. We're deeply interested in this committee's work because a large majority of our cases are people with serious mental illness and or people with IDD who are repeatedly criminalized for behaviors rooted in their illness or their disorders. We see this pattern reflected in the data from Senate Bill 1677 audit report, which was released in 2024, which states that 2/3 of the state hospital admissions are coming from jails. There are a couple of points I wanted to highlight for this committee today, which comes from our day-to-day casework, and I have a comment on the data presentation. The first, we see a lack of robust continuity of care protocol for people who are cycling repeatedly through the county jail system. I want to focus on one particular subset of that group, people who time out on the forensic wait list. So as per the audit report, 168 people had timed out on the wait list in the 5-year look back. And those timeouts create a revolving door, as jailers and sheriffs often tell us how those people come back on similar or higher level charges. Now, as per the audit report, 341 people were placed on the wait list multiple times on the same charge, and 10% reappeared on the wait list on new charges. In our experience, there seems to be no protocol to connect these individuals to appropriate levels of care. I mean, one day I'm incompetent to stand trial, next day I've timed out, I'm on the streets, cold turkey, no connection to appropriate level of care, and no continuity of meds. This is a major public safety issue, and I wonder if this population is targeted under the mental health justice grants that we just saw a presentation on. The other subset of the revolving door are people who are clients of local mental health authorities when they're booked into jail, but they're unenrolled from services if they're incarcerated for longer than 30 days. So upon release from jail, there is no mandate to re-enroll them into services in a timely manner. They have to go back in line, wait 4 to 5 months on an average to see a psychiatrist to get prescriptions for medications they may have been on prior to the incarceration. So we believe more robust protocols for access to care upon release from jail could help sort of narrow that revolving door. On the data piece, I wanted to point out that there was absolutely no mention of the forensic IDD population in the audit report, nor in the data presentation from this committee. As per HHSC's own data in the IDD Advisory Committee that the Texas Commission on Jail Standards runs, the largest number of transfers to SSLCs of people with IDD are occurring from county jails. Our small organization has dealt with 6 such cases in less than the last 12 months. I hope this committee has concrete plans to study and remedy this narrative by making recommendations for timely access to care so they don't end up in the criminal legal system. As per our open records request last year, there were 103 people identified as IDD who were awaiting competency restoration. 68 were awaiting forensic commitments at SSLCs, all of them in jails. 93 people were in an inpatient competency restoration program at a state hospital, and 1/3 of those had been through competency restoration on a prior occasion. 210 were on forensic commitment at an SSLC. Of those, 25 were undergoing competency restoration. This is all as of March 11th of last year. I would love to see some of this data breakdown in your data presentations. The second and last point I want to make is the number of people who died while on the wait list. As per the audit report, it was 54 people who died, and I hope we can center those outcomes as we talk about remedies for the people that are stuck in jails. Thank you so much for all your work. Really appreciate it.